Hi guys, my name is Nadia Shamimiti Ismail. I am year 2 of student medical imaging and my number is 082112.
I'm going to do an image analysis using the Paceman method on chest. I'm going to do an image positioning. The first one is patient's body will rotate to the left side since distance between the vertebral column and the sternoclavicular end of the left side are greater than right side. Second is patient body were tilted forward because more than 2.5 cm of lung epice above clavicle were visualized. The third one is patient's shoulder were pushed forward, indicate by edge of the scapula were refracted laterally and located outside of the lung field. The fourth one is patient's shoulder were not fully depressed, evidenced by the elevated of clavicle. Next is all first to 10 posterior rib were demonstrated above the diaphragm, indicates full aeration were done. So the last one is heart shadow size is not enlarged. I move to another Paceman method, which is for the alignment. The first one, the alignment of the S3 tube and patient body are not aligned because the center of the collimation does not fall at the centering point, which is T7. Next is alignment of the S3 tube and IR are not aligned because the distance from each of the film to the distance of the collimation are not equal for between top and bottom. And for the last one is alignment of IR and patient is not aligned because the center of collimation does not fall at the centering point, which is at T7. To correct this position, move S3 tube slightly higher until the saturated at T7. For S3 tube and IR, bring S3 tube slightly lower. So now let's go deeper on the collimation. For the chest, lung epice and costophrenic angle were included in the image, indicates that superior and inferior border are well collimated. For the lateral collimation, skin margin was included in the collimation. So for the exposure, consists of contrast and density. For the contrast, thick part, which are bony cortical outline of the thoracic vertebrae and posterior rib are clearly visualized, and thin part, which is vascular lung marking, are also can be seen. This indicate the amount of KBP is adequate. For the density, thick part, which is bony trabecular pattern of the upper thoracic vertebrae can be seen, and thin part, which is air-filled trachea, also can be seen. This show the amount of MAS also adequate. The range of KBP is about 110, and also for the MAS is 20. So let's explore about the marker. There's no evidence of marker presented. To correct this, put marker on top and at the site of interest of patient and not superimpose over anatomy of interest. Next is the aesthetic. For the aesthetic, the film size used is 35 x 43 cm and also used in lengthwise. Next is no evidence of preventable artifact such as necklace, and also proved by correct aspirations. For the last one is name. The patient's name, ID number, date and facilities name were included. The position of the patient's information should be placed on bottom at the right side of the cassette to prevent it from overlap with anatomical region.